one of the techniques we often use for people with low back pain or recurrent low back pain and instability in the lumbar spine and potentially stenosis is hip extension techniques. So techniques to restore the movement of hip extension. If they do not extend properly at the hip, they tend to compensate by extending more at the low back and increasing the symptoms in the lumbar spine or the symptoms of stenosis. So for hip extension, if I treat the right side, I place the left foot on the floor to stabilize the pelvis. I place a sandbag underneath the ASIS. I'm going to place the hip in extension. And then if the patient has some pain, I could do some traction, or I can also do some curve glide. So going on the greater trochanter and doing small rotation on the posterior aspect of the greater trochanter. And as I go into extension, I do a little curve glide of hip extension. At the end of the movement of extension, I can also do with a little bit of adduction, and I could add a little bit of internal rotation or external rotation, more internal rotation of work on the restoration of extension for gait. At the end of the movement, I ask the patient just to try to raise up the leg, the right leg up, and relax. I can then follow this through with small neuromuscular reeducation, and the patient will help me with that movement of extension. So I move up, you move up, good, 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 and isometric in extension, good, hold the leg up, good, and relax. This is a technique that can be used for people with stenosis or lumbar area with limitation of hip extension.